we got a patient over here, old from Philly, right?
Yep.
So clue us in. What can I do to help you?
I got some shoulder pain. Whenever I do any kind of pushing motion, I feel pain in the rear deltoid. And I first noticed a lot of pain when I was doing bench pressing, and then the entire shoulder was just very inflamed. So I stopped doing the bench pressing. But then whenever I try to do any sort of pushing, whether it's push-ups or just moving my hand up like this, I feel pain. And then when I move my arms like this, right at the top, I start feeling pain here. And then the other issue is my left foot. Yeah.
Sure. So what's going on with that left foot?
Okay, so I have pain in the heel, and then this area is a little swollen. And when I run,
well, we're talking about just Achilles itself, or this region over here.
This whole region, yeah.
Whole entire region.
Yeah. Mm-hmm.
Yeah. So when you're running, how far do you have to run until it starts showing up?
Lately, it's been maybe within a mile. Then I start feeling this area pulling a little bit.
Mm-hmm.
And then if I keep going, then this entire region gets re-swollen.
Pretty swollen. Yeah. Understood. Anything else I should be aware of?
No.
All right, let's roll.
All right.
So, this is instrumentation right over here. We're looking for signs of damaged tissues, which is inflammation. Inflammation tells the body, we gotta go fix this thing.
Okay.
So there are two signs that shows up for inflammation. There's going to be abnormal temperature, and that's what this device picks up. There's also going to be swelling that's going to stand out.
Okay.
I see there's a band of swelling over here, so I would not be surprised if we see some kind of reading there, and we do.
Okay.
Right here. So since there's a band of swelling over here, we're going to take a look, see what's going on in the foundation itself. How's that fella right there?
I'm okay. I don't feel any pain there.
Any tenderness? Because it is swollen here a bit. Just a bit. Here, not too bad, huh? I'm going to check this over here. This is not moving whatsoever on the left-hand side. Right side, do you feel how this is pivoting?
Yeah.
Moving? It's moving just freely.
Yeah.
This here, it's a brick wall. It's not moving whatsoever.
Okay.
Feel that difference?
Yeah.
Yeah. The left hip is moving just fine. That's pivoting just fine. Now we're checking what's going on. How's it? Okay. This is moving way too much. All right? So there's something going on in that fifth lumbar. We're not challenging too much there. Okay. So we're going to take a little closer look at the x-ray, see why that's moving way too forward, but you may have a spondyolithesis over there. So take a look at that one. See, now there is a band of fluid right over here. Let me check. Yeah, see?
Yeah.
So over here, it's supposed to move, and this is like a brick wall. It's not moving whatsoever. It's stuck. No, that's it. Here's the two major things we tested on you. I tested it, found out this fifth lumbar over here, it's moving too much.
Okay.
And yet the sacrum itself, it's stuck.
Okay.
So when I take a closer look over here, and we can see it on here, see how much this is supposed to line up? Over there? This bone moved forward.
Okay.
You can see it here as well. Just a tip.
Yeah.
It moves forward. Right? So, here's the thing. Just like our elbow over here, there's no way it's going to go past 180 degrees.
Right.
Same thing with the knee. Doesn't go past 180 degrees unless you break it.
Okay.
We have these two bones over here. Right? This is what prevents this top one to go forward.
Okay.
Now, when there's trauma, it can go backwards. And that's what I'm usually looking for.
Yeah.
But it should not go forward. As long as we have that intact, it's not going to move forward.
Okay.
Now, based on what I see over here, and I do see a discontinuity right here that tells me you fractured one of them out of the two. So this right side over here, there was a break on this side. This one's intact.
Okay.
This one's not.
Mm-hmm.
So as a result, we're seeing over here a slight rotation. It's like moving like this.
Okay.
Not too severe, but it is rotating enough,
Mm-hmm.
going like this direction. And that's also what we're seeing over here. The whole of our spine, everything is moving this direction.
Got it.
And it's supposed to be straight like this, but instead, as a result of that instability over here,
Mm-hmm.
this fifth lumbar over here, it's starting to move everything like this.
Okay.
So that's why we're starting to see every single bone over here is moving like this.
Okay.
And it counteract for that motion because, let's face it, the way you are right now, this bone over here, it's forcing your whole entire body to go like this. And you can't walk this way.
Yeah.
Right? It's going to be weird.
Right.
So no matter what, our head has to be this way.
Mm-hmm.
So therefore, the rest of our body is going to start twisting over this way.
Okay.
And then it's going to start going this way. And again, we still can't walk this way either.
Yeah.
The head, right? So that's why over here in the middle of our spine, start rotating this way.
Mm-hmm.
So that's what we're seeing over here. There is a curve here, curve this way, and a curve this way over here. Right smack in the middle of that fifth dorsal over here, that's what we tested for frontal new.
Mm-hmm.
That's being problematic.
Mm-hmm.
And that one over there, biomechanically and also neurologically, is innervating the muscular structures and also the skeletal structures for that right shoulder.
Oh,
So that may be explaining why you start having some difficulty bench pressing, overhead presses, so on and so forth, because it's compromised over here.
Okay.
However, all this, all because, see over here, it got twisted right in the middle.
Yeah.
Right? So that's what this thing over here, it gave out. It's just too much twist.
Okay.
So now, here's the other long-term strategy. What can we do about this fracture? Well, I hate to tell you to it, but bottom line is this: I can't fix that. Okay, I'm not a surgeon. That's not what I can do. However, what we want to do is minimize the left one from fracturing.
Okay.
So there's a couple of things you can take and supplements to help speed things up.
Okay.
First of all, I don't advise doing any deadlifts or power cleans or power squats with this one.
Okay.
Right? That's going to amplify things because you may be doing all that weightlifting, what have you, and it causes a microfracture in here. Right? Most of the time with microfractures, or because you're lifting all that stuff, for most bodybuilders, okay, when we do weightlifting, we says, oh, what is it? It feels like a muscle, like a muscle strain or sprain. Okay, so you don't, you shake it off.
Yeah.
But most of the time, that microfracture, it mimics like a muscle sprain strain. So you don't even know that it's fractured.
Okay.
The only way you would know is that you keep on doing it repeatedly, and suddenly one day it really gives out because there's only so much of those microfractures you can do. Because for most people, if they didn't weight lift or any excessive stress on that area, such as some dock loaders, they keep on improperly mechanically lifting, carrying hot, heavy objects. It's okay once in a while to have that little microfracture, and the body will repair itself. But if you keep on repeatedly applying a heavy duress force to that, it's like having that wedge right going into it. Eventually, it's going to break it right off.
Okay.
Right. This fellow over here, most likely, it's getting some stress to it as well.
Okay.
I don't know if there's any microfractures in it right now. Can't tell. All I can tell you right now is it's still intact.
Okay.
But if you want to reduce that risk from future fractures,
Right.
what you can do is there's a couple things. Is number one, I do recommend a microcrystalline. It's hydroxyapatite.
Okay.
So there's a product online that's called Jarrell's Ultra Bone Up.
Okay.
You can get it on Amazon.
Okay.
Highly recommend it.
Okay.
Great stuff. Another thing you can do also is there is since you're a fellow Korean, right? So there's like amazing bone broth soups you can take.
Okay.
Right? Like oxtail soup,
Okay.
we call gorgongtang or
Yeah.
solentang.
Yeah.
So any bone beefy broth soup.
Okay.
We want all those minerals, okay? The collagen, everything else. All that stuff is a great, excellent bone matrix material to help repair this.
Okay.
Same thing with this as well. I don't know if it's gonna, most likely it's not gonna fill it up at all because it's already broken off. So there's two ways we do with this. Either A, if you want the conservative route without any surgeries, since I cannot move this bone backwards, it's not possible unless I start to do like a kung fu thing and just punch it right to the front.
Yeah.
That's not gonna happen.
Okay.
Or B, we move this sacrum, the bottom piece, a little forward.
Okay.
because it is stuck on this side, and it's going to help from here, just unravel all the way to here, but it's never going to stay put, because again, that part's fractured.
Okay.
So all the things you can help stabilize this is you got to get that six-pack abs, right? And also do a lot of lower core strengthening. So I do recommend a lot of body weight, not power squats, but a lot of body weight, exercises such as leg lifts, squats, lunges, things of that matter.
Okay. All body weight. Yeah.
A lot of body weight. That's what I recommend.
Yeah. Okay.
Right. Just to strengthen this up, because again, we don't want to stress that one out.
Okay. Got it.
Right. Okay. So that's what we're going to correct this one. It's going to help stabilize that. Or the other option is, you may possibly find a surgeon who's going to bolt these two bones together. But keep in mind, most of them, right, they're not going to bolt this bone back into proper alignment. They'll keep it the way it is. So therefore, you're always going to be twisted like this.
Okay.
Right. So in a long-term situation, because you're still relatively young, if you thought this right shoulder is bad, it's just going to constantly get worse and worse and worse. Long-term situation. So there's two ways to go about it. Either A, you could do surgery and bolt that on, or another option is find a surgeon who can actually retract that bone backwards. I don't know if there's any, because I haven't found any in Manhattan yet. Okay. All right. Or the other thing is the conservative route. Get your lower core, strengthen up really strong, especially on the right-hand side. Right? Because we need to compensate that. Because right now there's nothing holding there anymore. It's just muscles and ligaments. That's it. Okay. In addition to, we also correct that from time to time. But since you're from Philly, we'll recommend you a Gonstead chiropractor in Philly. There are several of them out there, just north of there. You can go to them, and you just need this periodically corrected from time to time. Right? Get that fella more stable. Now, what's going on with the foot? I'm going to touch base with that with the nerve chart in a moment. What I do see is you got two things going on. The calcaneus over here. I want to see these two line up. You see this over here? You moved a little bit up. See over here? They're supposed to line up too. It's not. So the whole entire bone itself, it went upwards. So this one I need to align. And also, I'm seeing this first cuneiform, it's a little bit upwards as well. Including this metatarsal, it's also upwards as well. So this is, I want to double check after I correct this. I want to double check the biomechanics, how that thing is doing. This is the bone over here. This is what we see on the x-ray. These two over here, cuboid, and the calcaneus. These two, they need to line up. It's not doing that. This bone is slightly upwards. Right? And then we go to the other side of this one over here. Right? I do find that this one over here, it went superiorwards. Just a bit. But I want to double check after we restore the biomechanics of this calcaneus. Because this is the medial arch. There needs to have an arch. It needs to be a spring. On yours right now, when I see over here, it's very flat. And I don't see too much of that springy action going on, especially when I saw you walk in before. Actually, on both feet, they're pretty flat. And we go show to the viewers over here. Okay, it shouldn't be splayed out like this. It should be like this. But right now, yours is like this. It's spread out. Okay, see this over here? It shouldn't be. It should be nice and a little more straighter than that. But this is bulging out here, and then definitely bulging out on this side as well. So the lateral arch collapsed over here. This is flat. Okay, so the transverse arch also collapsed. And then we see over here, okay, the medial arches. I can barely put my fingers underneath. So this is pes planus, flat feet. Both of your medial arches. So we're saying all three arches collapsed. Right? And then also we see here evident is that you do have a little bit of hammer toes going on here as well. That occurs when the transverse arch collapses. Right? So now let's go to the nerve chart. So now we identified there's a problem, and there is a unilateral pars fracture. So we're talking a right pars fracture right over here. Now because the nerve is being compromised, over down here, you're talking about, I have some Achilles pain plus some lower calf pain. This region over here, especially when you start running within a mile or so. So typically, when there's a sacral nerve involvement, I typically find a problem over here. because the nerve is being pinched over here, that fifth lumbar nerve, it also innervates this region over here as well. So therefore, since it's compromised, that's why you feel the pain now in the Achilles, but also in that lower calf as well. So the answer is, we have to make this more stable. I cannot correct this, again, because that's fractured over there. That's a done deal, but we can make this a lot more stable and help it hold a lot longer. Right? Typically, I would recommend the way we're going to approach this case, if you stayed, if you're a resident over here in the New York City region, I would see this, I would see you one time a week until we get this thing more stable. And eventually, for most people who have this type of fracture, right, we only see them either once a month or once every 2 months for regular maintenance to keep this fella stable as much as possible. But if do you run more professionally or amateur level? Or just for leisure, for fun?
Amateur, yeah. I mean, I run marathons. So.
Okay. So in that case, if you want to be in your tip-top condition, then I would recommend seeing the Philly, Gonstead doctor over there, at least either once a week or once every 2 weeks. You'll notice yourself as well, in terms of your performance. There's no question about it. As you start running, over time, you may notice that, hey, wait a second, my running gait is not as smooth and not as fluid as it should be. Go ahead and go see those docs over there and have that realigned again.
Got it.
All right? Let's roll. Hello. Walk around. How's the calf?
It's good. Yeah. I don't feel any pain right now, but I won't know until I start running. But
all right, fair enough. Fair enough. Okay, let's go ahead. Let's work on your mid back. Okay, go ahead and relax his belly right there. Go ahead, relax, drop that belly. Little more. Little drop. Stay right there. Don't move. And back. Okay, we're gonna get the scapula moving again. Just relax. There it is. Good. AC's a little bit out. Got a little click in there?
Yeah.
Yeah, that's what we're gonna set this AC in there. Okay, also, right. There it is. That's right there. Little one. Here it goes. Okay. Give it a whirl, see how I like it.
Yeah, it's way better. I don't hear the clicking anymore. So.
Nice.
Yeah.
Try to overhead press.
Yeah, it's not as painful. I may still feel a little something, like when I get really close up here, but yeah, it's definitely less. Yeah.
How much less?
I would say a third less.
Yeah, that's good progress right there.
Yeah.
Yeah. So just keep in mind, okay, this shoulder over here, it's never going to be 100% perfect because of that fracture all the way down there.
Okay.
It's causing the whole entire spine itself to twist up a bit.
Okay.
But in essence, what it's doing is that it's causing the whole entire spine itself to twist like this. So it is going to impact the shoulder over here.
Okay.
So yes, we're going to help make it, restore some of the biomechanics of it, and leave some of the pressure off of the shoulder over here.
Okay.
But there's no way to make this 100% until we start stabilizing that fellow, that fifth lumbar all the way straight down there.
Got it. Okay.
All right?
Great.
Okay, foot time.
All right.
All right, first things first, let's check a good one. This thing also needs work. It needs work. All right. So you do have the calcaneus. It's a problem. All right. All right, flip over, please. Let's address your right one, your good foot, your somewhat good foot first. There we go. There it goes. There's one. Slide down a little bit. Stop right there. Yep. Let's go ahead. Let's pump this talus or this calcaneus over here. There we go. Got half. All right. Got a little more of that fall. Little. Ooh, nearly this fellow stuck. We got a piece. Just meat. A little more. Good. Let it go. A little more. We're gonna set this bone right here. Good. All right. Flip over. Let's see how this calcaneus is. Okay, get a little more out of it. Put your pressure right on against my knee. There it is. There's the remaining piece. All right, Jay. Go ahead, walk around.
Do you feel more stable, actually? It's weird.
It's not weird. You restore the biomechanics of your feet. Of course it feels more stable.
I still find it strange. I'm so used to it being wobbly, so now it's not. It's just when I push down and walk off, it's my ankle's not moving around, which always happened with this foot. So
And that's great progress right there.
Yeah.
All right. So, do you have orthotics?
I have a thing called Superfeet in my inserts, my shoe. Yeah.
Okay. Well, that's a basic one.
Yeah.
But based on what I see already in that Sacrum, that thing's gone already.
Yeah.
Right. So you can see over here already. We already can see over here. You wore out the pattern over here, and also the outside over here. So you got some supination going on over here, and you got some wearing out over here. So you got some pronation going on over here, and you do have some nice, decent toe off, but you know it's excessive over here, and you don't have too much in your mid-tarsals over here. You're trying to wear them out, but I like to see more over here rather than the center over here. So this tells us that no, your feet are, without doubt, very flat.
Yeah.
Okay. So having the super feet, these orthotics is a basic one, but see over here, it's shot, it's gone. Yeah. Right. There's just nothing left on this on this thing. These things also, you could tell this is way beyond 500 miles. Right. That's ran these things. Okay. Right. So for most runners, shoes needs to be replaced every 500 miles or every season, whichever comes first. Right. So for amateur, someone who does it real hardcore, it's not too uncommon to go through like 4 pairs of sneakers in a year. Right. Yeah, quite a bit. Yeah. Because you have to keep in mind the cushions. You need to protect your feet, and especially when you don't have any proper biomechanics in your feet, because it's all all the arches collapse. Yeah. You need to have more supporting structures in your shoes itself. Sure. Right. So make sure replace the orthotics, replace these shoes ASAP. Yeah. Yeah. Right. Okay, champ. All right. Anything else?
Nope. That's it.
All right. We're all done.
All right.
And then we'll send you to a guy in Philadelphia. Okay. And I'll take good care of your feet and your back as well.
Okay. Great. Thank you.
All right. Oh, you're welcome. All right.